Hi, today I'm going to be addressing ingrown hair and how to deal with it. Basically, it can happen in anybody who's having thin or thick hair, coarse or fine hair. It can happen in men and women, and the areas which we commonly find to be affected are the beard area in men because they frequently shave the beard, and in women mostly underarms, the bikini line, and also sometimes those of you who get waxing or threading down on the face, you might have noticed that you feel these tiny bumps which you might assume are acne, but they could be simply the ingrown hair in that area. So what do we do about this? If it is fine hair that is just growing into the upper layers of your skin, towards the downwards direction, then we could probably manage it by using some topical keratolytic agents, by just applying a cream or so. But in case it is thicker hair and it is going through and through into the dermis or the lower layers of your skin, then it is a little difficult to manage it medically. We might have to physically remove the hair using some instruments, and ultimately this is going to be a recurrent condition. So whichever method of hair removal you're using, it could be shaving or waxing or threading, and sometimes if you're doing dermaplaning or dermabrasion on your own at home, even that can lead to ingrown hair, and it is important that we medically address it. And even if you're trying to remove it, it has to be done in sterile conditions so we avoid a secondary bacterial infection. Mostly in men, those of you who are suffering with these ingrown hair in the beard area, it's not an uncommon problem. We see it a lot. So this could be happening because of the texture of your hair. Probably if it's too thick or curly, especially, it could be growing inwards. And when it is quite troublesome with pusful lesions or chronic infection which is recurrent and it's not going away, we call it pseudofolliculitisbarbae, and it is quite a painful situation, and we may have to sometimes give you topical or even systemic antibiotics to take care of it. So ultimately what I'm trying to say is any of the hair reduction or removal methods that you're following, if it's causing ingrown hair, then it's not very pleasing to look at, especially if it's growing in the inner thighs or on your legs, or even around the elbow area. It could be these areas could be getting affected more frequently, probably because of the laxity or the softness of the dermal tissue in these areas. So I would suggest that you stop shaving or waxing or so for 30 to 45 days at least, and then probably think about laser hair reduction, because when we are trying to reduce the thickness of the hair and also when we are treating it using laser, then the hair which is growing back is much thinner, the shaft of the hair is much thinner, and the direction is more even, so it is not directing itself downwards, growing into the surrounding tissues. It's mostly we are trying to direct it to grow back normally. So eventually the recurrence of the ingrown hair decreases, and with moving on with further sessions, your hair becomes finer and even invisible. So this is quite a researched method of hair removal. We've treated quite a few cases of ingrown hair with the help of laser hair reduction, mostly the problematic situations where the hair is quite coarse. And surprisingly, I've come to learn that there is a genetic predisposition which can lead on to ingrown hair in some people. That is because of certain mutations that can happen at cellular level in the hair and the surrounding skin, where the keratinocytes become more adhesive. So in these scenarios, we definitely have to resort to laser hair reduction. And laser hair reduction is quite safe. We make sure that we are conducting it using all the aseptic precautions and maintaining local disinfection so that you are not going to have secondary bacterial infections for sure. And of course, we are going to top it up after the session using a topical antibiotic, so that also decreases the tendency. And mostly whatever allergic reactions you're getting in the form of bumps on your skin or redness post your waxing will not happen because of laser hair reduction. And especially if you're using a kind of laser called as ndyag, all the more the tendency of your skin to have any secondary adverse events are minimized to 0%. And also if any of you are trying to self-treat these ingrown hair by scrubbing your skin or doing any forms of physical exfoliation using a coarse exfoliator, either multani mitti or apricot scrubs or basin, any of these methods, please understand that because of the color of our skin, we have a high tendency to develop post-inflammatory pigmentation, and none of us want that. And if it's even more severe, we can end up with macular amyloidosis. Like you can see in my previous post, it's one of the most troublesome pigmentary condition, and also very difficult to treat, and also very expensive when you're trying to treat macular amyloidosis using laser. So do not resort to physical scrubbing or exfoliation.